This story reflects one person's experience. Not every person will receive the same results. Bear in mind that all surgeries carry risks. This treatment is prescribed by your physician and is not for everyone. Please talk with your doctor and see if it's right for you. Your physician should discuss all potential benefits and risks with you. Important safety information about the X-Stop Spacer appears at the end of this video. For additional information about this product and treatment options, please visit www.xstopspacer.com. An afternoon on the golf course, or a drive in the country. Simple pleasures that mean the world to Judith Lundberg and legendary pro golfer Lee Trevino.
I'm swinging about as hard as I've swung in a long time.
I'm having the time of my life.
I'm back to my old self. I'm doing anything and everything that I've always done before. Life is good again.
Judith and Lee have lumbar spinal stenosis. More than 800,000 Americans are diagnosed with this crippling spinal disease each year.
Complete resolution of the symptoms when he sits down, so he's a perfect candidate.
Okay. Lumbar spinal stenosis is basically narrowing around the nerves that pass through the lower back.
Dr. Ira Nick Shammy is an orthopedic surgeon at the University of California, Los Angeles. He points out that as we age, ligaments and bone that surround the spinal canal can thicken and pinch the nerves.
As this narrowing occurs, what the patient experiences is pain in the buttocks and the legs because the nerves are being compressed.
Symptoms of lumbar spinal stenosis may include pain in the lower back or legs, especially when standing or walking, numbness, weakness, stiffness, or dull cramping in the lower back and legs, and painful tingling or a pins and needles sensation that shoots down the back of the legs.
Pain can get very severe and markedly limit the patient's activity level.
Dr. Grant Skidmore points out that for many LSS patients, walking or simply standing can cause agonizing pain.
When we stand up in an upright posture and with the weight of our body borne on the low back, this all combines to cause increased pressure on the nerves.
For years, Judith endured chronic back pain while she and her husband raised 4 children and ran a dairy farm.
My back always bothered me through the years, and I just figured it's because of kids and the farm work and stuff, because I really did lift a lot of heavy things. It would hurt so that it would bring tears to your eyes.
Even simple tasks in the garden became impossible.
When I was working in the garden, I just got to the point where I couldn't bend over and, say, pick tomatoes. There was no, if I picked one, I was lucky, or 2. I can remember that pain. That was terrible.
And pain plagued Lee Trevino for years on the pro circuit.
You endured it. That's it. You just went ahead and played through it. You got used to it. I won golf tournaments with bad back pain.
But in 2004, the pain became unbearable, and the active lifestyle Lee led came to an abrupt end.
I just wanted some life back. I wanted to be able to do something. I wanted to be able to walk my dogs, putt on the putting green, hit a few practice balls. I mean, come on, put your clothes on one leg at a time like you've done all your life. Couldn't do any of it. Could not do any of that. None.
Trevino turned to Dr. Ralph Rashbaum, an orthopedic surgeon, for help.
He was at a point where he literally was crawling through his home. Forget golf. Forget getting out of the house. He wasn't functional.
X-rays revealed Trevino had lumbar spinal stenosis.
The bone was on the nerve, and I couldn't move, could not move. The only time that I was comfortable is being hump-shouldered and going down. I had lost about 3/4 of an inch to an inch in my height.
When we take that load off of the low back or we bend forward, such as leaning over a shopping cart or sitting down, that flexion motion opens the spinal canal by unbuckling the ligament, just opening the canal up a bit to give the nerves a little more room, and that is enough room to relieve the pressure.
When the space is opened up, you have more room for the nerve, and that's why
doctors will usually first recommend conservative treatments to relieve the symptoms of lumbar spinal stenosis. These treatments can include pain medications, physical therapy, and epidural steroid injections. Like many LSS patients, Judith Lundberg was reluctant to undergo major surgery to treat her back pain.
I have a couple friends that didn't come out of operations very good like that, so it was like, I don't know, I'll just take my Advil and keep going.
But medication did little, if anything, to relieve the pain.
I took 3 Advil in the morning, 3 at noon, 3 at 4 o'clock, and 3 when I went to bed.
If you see the number of pain pills she took in a day, it scare you. She took more than any person should ever have, you know, just to keep the pain down.
Lee Trevino tried epidural steroid injections to treat his acute back pain, but the relief was temporary.
I had epidurals, biggest Band-Aid I've ever seen. It'll come back, and it'll come back in a vengeance.
Determined to maintain the mobility in Trevino's back, Dr. Rashbaum was reluctant to perform a traditional laminectomy. This surgery removes parts of the bone in the vertebra called lamina, as well as ligaments that protect and stabilize the spine.
Given the nature and the intensity of the pain he was suffering from, he would have been subjected to a standard decompressive laminectomy, which might in fact rendered him unstable, and that would have ended his golf career.
He said, you know, the problem that you have, you may never play golf again. And it was very difficult for me to understand that, and I wouldn't accept it.
Dr. Rashbaum thought Trevino would be an ideal candidate for an innovative device called the X-stop spacer.
This is one vertebra, this is another vertebra, and this is the disc between them, the space between them. With lumbar spinal stenosis, those start to come together like this. Well, what does this spacer do? It simply jacks the spine up.
Dr. Rashbaum assured me that the advantages of the X-stop over laminectomy was no loss of rotation. Because in my business, rotation is everything.
The X-stop spacer is implanted between the spinous processes and is designed to keep the space open, so when a patient stands up, the nerves are no longer pinched.
This X-stop spacer, by keeping the bones apart, prevents from this crowding or pinching of the nerves to occur when the patients stand up.
Trevino didn't hesitate to have the X-stop procedure done, and he couldn't believe how he felt just hours after the surgery.
The X-stop was the most amazing thing that I'd ever seen, because I immediately went without pain. The pain was gone.
While Lee received satisfactory results, it's important to note that all spine surgeries carry risks. The X-stop spacer may not be right for those with certain allergies, spinal anatomy, or severe osteoporosis. Approximately half of patients studied achieved treatment success. And Lee Trevino can't believe the impact the X-stop spacer has had on his daily life.
I walk downstairs and I take my little puppies out. I go into the gym and I'll work out a little bit. Then I'll come back inside and clean up the breakfast dishes. Got my life back.
There are a number of benefits with the X-stop spacer. It's a less invasive surgical procedure. There is the option of local anesthesia. It's potentially an outpatient procedure. It preserves normal bone anatomy. There is a potential of a short recovery time, and many patients experience rapid and sustained relief.
The benefits to the patients are that it's a quick procedure that has minimal risk. The results are immediate, and they appear to be long-lasting so far.
And the X-stop spacer has been shown to be superior to non-operative care.
In the clinical trial, X-stop was head and shoulders above conservative management, specifically epidural steroids and physical therapy and anti-inflammatories. There was no comparison.
A number of lumbar spinal stenosis patients who have been in treatment for their symptoms for at least 6 months are potential candidates for the X-stop spacer.
The indications for X-stop are patients over 50 years old with the diagnosis of spinal stenosis at 1 or 2 areas in their low back. Clinically, the pain worsens with activity and it's relieved when they sit down.
If I can have you look at this one area here.
And Dr. Rashbaum emphasizes that there is another key indication that an LSS patient could be a good candidate for the X-stop spacer.
If you're sitting and you simply lean forward like this, elbows on your knees, does that resolve the problem? If it does, then immediately, okay, that patient can be conceived as a candidate for the use of this device.
So this is where your nerves were pinched. The overgrown joints are pinching the spinal nerves, the nerves that travel to your leg.
Judith Lundberg was thrilled when Dr. John Herzog, an orthopedic surgeon, said she could have the X-Stop procedure done.
I'm just so happy that I found out there was a way to make it better.
She met the criteria, was interested in the technology, and benefited tremendously from the X-Stop placement.
Judith was amazed how she felt just 24 hours after surgery.
The next morning I get up and I'm walking and there's nothing wrong with my legs. My legs are fine. I mean, you knew that your back was sore, you were operated on, but I had no pain, I had no tingling in my feet. It was better.
After a short recovery, Judith was back living the active lifestyle she loves.
Okay, you ready? Oh, you want to throw it?
And now she can enjoy her retirement and her family.
Stay up here. Oh, hey, that's good, I caught it.
I don't know that I can think of anything that has been as rewarding to me. I mean, I thought getting married was, my kids, having the life we had.
Oh, carry you, huh? Yeah, I can carry you.
But not to be in pain anymore is like, it's the best thing that's ever happened to me.
And now Lee Trevino can relish the simple joys in life that were impossible before his X-Stop procedure. Most importantly, Trevino is back on the PGA Champions circuit, playing the game he loves.
I believe in this more than I believe in my putting stroke. And I tell you what, I think highly of my putting stroke.
Now, both Judith and Lee live their life with hope and look forward to the future.
I feel like I'm full of life again.
I'm telling you something. The X-Stop gave me my life back.
For more information, visit xstopspacer.com or call 866-581-2717.